My name's Andrew Gerber, and I'm the President and Medical Director of Silver Hill Hospital in New Canaan, Connecticut. We are a full-service psychiatric hospital for individuals with mental illness and addiction. We have 3 levels of care here at the hospital: inpatient, residential, and outpatient. And we are looking for folks who want to work at our hospital. In particular, we are looking for nurses or graduates from the School of Nursing, psychiatric technicians who can be folks who have been pre-med or other fields and are interested in learning more about what it's like to work on an inpatient unit, residential counselors who are folks who want to work in the residential part of our hospital. You can have social work training or other trainings to do that, and we're looking for social workers as well. So really lots of different parts of the hospital. We are devoted to providing the best possible care for our patients. We've been here for over 90 years. We are the site of the first community mental health clinic in Fairfield County, and we're looking forward to new and exciting programs. We're based on our people, so we're a fun place to work with great teams, and I hope you'll learn more about us. Thanks.
Oh, good morning. I'm Sharon Kowalchuk. I'm the Chief Nursing Officer here at Silver Hill, and I want to welcome all of you from Sacred Heart. That is where I did my doctorate, so I'm very partial to your school. We have a lot of positions here that I'd love to fill with some of the alumni from Sacred Heart. One of them is a psychiatric technician, and that role you would be working with the nurses, the rest of the interdisciplinary team, the social workers, and the physicians, and working mostly one-on-one with the patients and also as a team. The ratio there is about 1 to 3 patients per psych tech and about 1 to 6 patients per RN. The RNs are really the team lead on days, and day shift is 7A to 7P, and on nights, and the shift there is 7P to 7A. Most of our nurses work on the inpatient area. Some of them work in transitional living as well. But we're mostly recruiting for either the admissions area, transitional living, or inpatient areas for the nurses, and the psych techs for the inpatient services. So if you have any questions, please feel free to contact us, and I'm looking forward to interviewing you. So I hope this will be a first step on your career path.
Hi, my name is Alexa Pazniukas. I'm the Director of Clinical Operations here at Silver Hill. I'm a social worker by training. I've worked here at Silver Hill for 7 years now. I started here working as a residential counselor, which is the role that I oversee. I work in our transitional living side of the hospital, working very closely with our residential counselors who work within our 7 different residential programs. So the residential counselors are really responsible for maintaining the safety and structure of the house. So the patients live there 24/7. We are looking to hire residential counselors for the 3 different shifts. So we have a day shift, an evening shift, and an overnight shift, 7 days a week. And it's a great role because the residential counselors are really getting a lot of exposure to different diagnoses, patients that may be in crisis, patients that really rely on the support and compassion that the staff provides to them. So they're here to get better and learn skills, and the residential counselors are a major component of their recovery process. You work as an interdisciplinary team member, so you are really the eyes and the ears of what's going on within each house. If you're observing a patient, struggling with a family interaction or a peer interaction, that's really useful information that the psychiatrist and the social worker can use to formulate a treatment plan for the patient. So the residential counselors report back to the team with those observations. There's also some components of observing patients self-administer their medication, so there's some awareness of pharmacology, and that can be helpful with future career goals if you're going to work in this field. You also have the opportunity to run some goal setting groups or DBT skill review groups. Obviously, there's training provided for that, but it's again a nice introduction to especially those that may be interested in going on to have careers in the social work field. It's a team environment. It's a fast-paced environment, but there's a lot of support for the staff that work here, and there's always staff available on site to support the residential counselors when they need it. So it's a great first job out of school. Again, a lot of exposure to different diagnoses and psychiatric conditions, and we'd love to have you be a member of the team. Thank you.